Good afternoon. So I've been asked to come and explain what the Food and Nutrition Service did over the last 8 years, 3 times in the last 8 years, preparing a regulatory impact analysis for a proposed interim final and final food package rule. I hope this is helpful to you. Let me start with some basic background. The elements of regulatory impact analysis are something that OMB specifies, and the Bible on this is Circular A4, regulatory analysis. OMB document that's written for federal agencies as a whole. It's in general terms. It's a bit unapproachable, so I would recommend that you look at the second item on this list, the regulatory impact analysis primer from OIRA. It's the Office of Information Regulatory Affairs, also part of OMB. That summarizes in more concise terms what the elements of a good impact analysis are and the best approach to analysis. It's also a frequently asked questions document from OIRA that's helpful. These are taken from the OIRA documents. The key regulatory impact analysis elements are a statement of need for regulatory action. These are the nature and description of the problem to be addressed by the regulation and how the regulation will meet that need. Now, for your task as the committee, FNS would just benefit from IOM's analysis that discusses the alternatives, or excuse me, that discusses IOM's rationale for its recommendations. Those are things that will go into our statement of need for regulatory action if there is that step. The OIRA document stresses the importance of identifying alternative approaches to regulation. And also, the key of the impact analysis is the estimate of cost, benefits, and market impacts. I would stress here that all of the impact analyses that FNS produces, we strive to quantify and monetize all of the estimates to the extent possible, but discuss qualitatively, when not possible, any of the impacts, including benefits. Methods and sources should be fully documented, and a key point here is that the analysis should be documented well enough in the impact analysis to be reproducible based on the explanation contained in the document. Use of tables, plain language, and an executive summary are important elements here. And I should just add that the detailed estimate of cost, benefits, and impacts should apply both to the primary estimate and as well as the alternatives considered and not pursued. These are the elements of the analyses that FNS has prepared for its proposed interim and final food package rules in 2006, 2007, and 2014. Let me just stress this is not an interpretation of OMB guidance. It's not my job to do. But at the highest level, all of these are contained in Circular A4 and in the summary documents from OIRA. Every cost analysis has to include a carefully constructed baseline, something that might be overlooked, but that's critical, obviously, to comparing the difference between the proposal and the current state. The analysis of costs should, in our experience, our impact analyses are largely a narrative discussion of the analysis with tables, lots of tables. Tables are useful for summary purposes and also for getting complicated points across efficiently. The majority of the analysis for our impact analyses of WIC food package regulations have been on USDA costs of the revised food packages. But the analyses also include an estimate of administrative burden at the state or local level. Burden hours we, in the past, have quantified in terms of labor costs. As I mentioned before, a key point is that the analysis, and we strive to do this in our impact analyses, is present all the steps separately. Transparency, again, is critical. The goal is to provide enough information for the analysis to be reproduced by a third party. Just to break it down a bit further, the key components of the analyses for the WIC rules in the past from FNS have been the price, estimate of prices, prescription or redemption quantities, and participation projections. FNS has found it useful to present USDA costs at both the level of the provision or food item and at the level of the individual food package, summed up to the food package. It's summed up different ways, offers some benefit for interpretation. Market impacts. FNS's proposed and interim rules contain very significant changes to the old food packages, and those impact analyses include a macro level look at the possible impact on total sales in the U.S. market as a whole. Final food package rule and impact analysis was a less substantive, not substantive, a less, it was not as great a change, and we did not include a U.S. market analysis in that impact analysis. For benefits, FNS RAs in the past have described benefits in terms of the rule's likely or intended effect in support of advancing the nutrition guidance behind the IOM recommendations. This has been a qualitative secondary analysis, not a primary analysis of the rule's impact on health-related objectives that underlie the nutrition guidance. Our past impact analyses have not been, in essence, an analysis of health outcomes. This is just continuation of the last slide. Alternatives, I discussed this a minute back, but an example from the final rule published in 2014, the agency considered limiting yogurt as a fluid milk substitute just to fully breastfeeding women. So that's the kind of alternative that was considered in the regulatory process, ultimately rejected in favor of the final rule, but was costed, the impact was estimated in the final impact analysis. Our impact analyses are all based on estimates, both price, participation, and quantities are all estimates to some extent. So we have an uncertainty section. Some of the information that we use in our estimates, frankly, are weaker than others. So the RAs, our impact analyses, include sensitivity analyses. These are alternate cost or benefit estimates under assumptions that differ from the primary estimate. Some of the uncertainties examined in our past impact analyses have included dairy price volatility, so different assumptions about milk prices, assumptions on preference for soy beverage, a new food item in the WIC packages in the rulemaking process. So we didn't have any administrative data to go on, and we're uncertain of the take-up rate and also the rate at which it would be offered by state agencies. And the cash value voucher for fruits and vegetable redemption rates. The last item on this slide is an accounting statement. Our impact analyses have always used current dollars for the primary estimate, but we do also include an accounting statement which uses discounted dollars at discount rates specified by OMB. Some of the principal data sources that we relied on for our impact analyses have included the WIC Participant and Program Characteristics report. I don't know if this has been mentioned earlier today, but this is a study that we do every second year, collects information from state agencies that was originally collected at certification of WIC clients. There are actually two data sets that come out of this process. One is a food package data set. Those contain the prescription amounts for individuals in the WIC program for the month of April in the even year that the study was conducted. And then the census data set on the slide is referring to mostly the information collected at certification. We also use, to some extent, administrative data on participation and aggregate food costs. These are things from our website. Third-party food price data. This is something Anne-Marie mentioned before. We use the same panel data that Anne-Marie mentioned for the retail prices. And research study data from USDA and others. And finally, for projecting estimates into the future, we use consumer price index data by food group from BLS. This is just an example of the studies that are cited in the final WIC food package rule impact analysis. Some of these are authored by people in this room. So some challenges. I just want to sum up with a couple of challenges. Food package 3, administrative data from the WIC PC process is incomplete on prescriptions and on just the number of food package 3 participants. This is a consequence of the way the food package data set is coded. I can explain that more later if you're interested. So we're relying on estimates based on partial data. Our food package 3 estimates have always been the weakest piece of our analyses. Estimating take-up rates of items new to the food package. This is a challenge. It's not hard to convey what I'm talking about, but having no administrative data on prescriptions or redemptions for items that aren't yet in the package, we have been relying on the data from other sources, including the panel data that Anne-Marie mentioned again, WIC prescriptions of foods that are from the same food categories. An example there was in estimating a potential take-up rate of the whole grain item added to the food package. We looked to the prescription rates of cereal in the existing old food packages. Interaction effects, these aren't so much a challenge, it's just something to keep in mind. Some of the provisions, when we estimate them separately in the analysis, depend on whether one of the other provisions is implemented or not. So there's some choice to be made where you show the full effect of provisions that interact. And finally, I just want to say that the 2014 final rule is not yet reflected in the prescription data that we'll have from the PC, participant characteristics study data. That's both the food package data set and the census data set I referred to earlier, nor is it going to be fully reflected in administrative data. My last slide is just a resource to where you will find the impact analyses. They're hidden in some cases, but these show you both the page numbers and Federal Register documents and on the FNS website. That's it. Thank you.
Any clarification questions from the panel? I had a question.
Sure.
What's a reasonable number of alternatives?
I think the alternatives section is driven by what, I mean, for the agency, it's driven by what we actually considered as an alternative to in the rulemaking process, just to be transparent on what the thought process was. Like I said, what's helpful for the agency when we actually do develop a rule is what are the alternatives that you considered. So there's really no limit to that. It's just what you seriously considered as a potential alternative to the final recommendation.